Friends, you might have noticed the change in the history of the patient. Medical history: patient is diabetic who is taking insulin. Social history is not significant. In the additional information, it's given: while dentist was discussing the treatment plan, patient started sweating and became unconscious. Guys, you just have only two things given in the additional information. First is sweating. Second is he became unconscious. Now, this is a very difficult question. We have to find out the clues from the case history. The first clue is patient was diabetic. In the additional information, dentist was only discussing the treatment plan. He was not administering local anesthesia. He was not doing any procedure on the patient. So basically there wasn't any situation in which patient might have felt scared because dentist was only discussing the treatment plan. So guys, this is a case of hypoglycemia or insulin shock. Hypoglycemia, that is the level of the glucose in the blood, it decreased and patient became unconscious. Guys, this situation can be fatal for the patient. So let's start discussing its signs and symptoms. The first sign and symptom is the patient may be feeling very nervous or anxious. The patient can be sweating. Patient can be having cold or and clammy skin. Then there can be some behavioral changes, like patient may be feeling irritated. Then patient might be feeling some kind of dizziness or confusion. Patient may be having tachycardia. Patient can have decrease in the blood pressure. Then patient can be feeling lightheadedness. Patient might be feeling nausea or vomiting. Then patient may be feeling sleepy. Then patient may say that I am feeling very weak or that I don't have any energy. Then he might say that I am feeling tingling or numbness on my lips, tongue and cheeks. Then patient may be having some seizures. So friends, out of all these signs and symptoms, we just have sweating and unconsciousness. The difference between hypoglycemia and hyperglycemia is, in hypoglycemia, patient has sweating and cold and clammy skin. In case of hyperglycemia, patient is feeling hot and his skin is dry. Let's now discuss the management of hypoglycemia or insulin shock. Friends, now there are two situations: whether patient is unconscious or patient is conscious. Conscious or unconscious. If the patient is conscious, then we don't need to worry that much. We can just give oral glucose solution to the patient and he will feel fine. But even if after giving oral glucose solution, patient does not feel fine or the treatment is unsuccessful, only then you need to give a call to 911. So just for the sake of ACJ exam, if the patient who is having hypoglycemia or insulin shock but patient is conscious, the only treatment is giving oral glucose solution. But if the patient is unconscious, now we need to worry. The management is different than a conscious patient. Since patient is unconscious, first will be head tilt, chin lift. Second is administration of IV glucagon or dextrose solution. Third is call emergency medical services or 911. Call 911. So guys, now you have seen, in a conscious patient we will just give oral glucose solution. In unconscious patient, head tilt, chin lift, administer IV glucagon and call 911. I forgot to mention, that is, we also need to administer oxygen in case the patient is unconscious. So basically, whenever a patient is unconscious, we need to give head tilt and chin lift, and second is we need to administer oxygen. So guys, always remember whether patient is conscious or unconscious and choose the options accordingly. The next emergency is patient is feeling dry mouth, looked confused and is having hot dry skin. Before I go in the diagnosis of the emergency, you might have noticed that I have changed the medical history to uncontrolled diabetes. Now, patient was feeling dry mouth. He is confused and he is having hot dry skin. Guys, I just mentioned that in case of hypoglycemia, patient is having cold and clammy skin, he feels sweating. But in case of hyperglycemia, patient has hot dry skin, he feels flushed. Now, patient has a history of uncontrolled diabetes. This will lead us to the diagnosis. Now, our diagnosis can be hyperglycemia. Now, to find out whether our diagnosis is definitely hyperglycemia or not, we will look into the additional information. Dry mouth, confusion, hot dry skin. All these are symptoms of hyperglycemia. In addition to these symptoms, the other symptoms are flushing, nausea and vomiting, tachycardia, decrease in blood pressure, then shortness of breath. Patient might be feeling weakness, or he may smell fruity in his breath. So guys, now we have all the signs and symptoms related to hyperglycemia. Moreover, in the medical history, it is mentioned that patient is having uncontrolled diabetes. So the diagnosis here is hyperglycemia. Just for your information, guys, hyperglycemia does not set very rapidly. It takes few days for hyperglycemia to show its proper symptoms. But for the hypoglycemia, the symptoms can be felt very suddenly. So hypoglycemia is a big emergency for a dentist, and hyperglycemia is not considered that big an emergency, but for ACJ exam we need to remember hyperglycemia and its signs and symptoms. Now let's discuss its immediate and appropriate management. Always remember, if the patient is conscious, for ACJ exam you don't need to do anything. No intervention necessary. No intervention necessary. I am talking about ACJ exam, but in case in the options you get monitor vital signs, then instead of choosing no intervention necessary, you should choose monitor vital signs. But in case monitor vital signs is not in the option, then no intervention necessary will be the answer. But if the patient is unconscious, always remember, when patient is unconscious, we do head tilt, chin lift, we administer oxygen, and in case the patient is unconscious, in case of hyperglycemia, we will call 911. Okay, So now let's discuss another important emergency. Guys, I have made some changes in the question. The medical history is not significant. Patient is having allergy to acetyl salicylic acid or aspirin and latex. In the additional information it is given, while placing rubber dam, because the patient might be getting endo treatment done because his tooth was aching. So dentist noticed that patient has started wheezing heavily and blood pressure is very low. Guys, in the question it was given that patient was having some allergy to latex. Now the rubber dam sheets, these can be latex or latex free. But in this case it is not mentioned that the rubber dam sheets were latex free. So we will consider that rubber dam sheets were made out of latex. So while placing rubber dam, dentist noticed that patient started wheezing heavily. That is, he is having difficulty in breathing. He cannot breathe properly and his blood pressure is now very low. This is a very important case because you know that patient was already having allergy to latex, but still dentist used rubber dam. So this is a clear-cut case of anaphylaxis. Guys, in case of anaphylaxis, the major signs and symptoms are, the first one is laryngeal edema. Second is hypotension. And third one is bronchospasm. These are the major signs and symptoms of anaphylaxis. The first one is laryngeal edema. Second is hypotension. Third is bronchospasm. There are some other minor signs and symptoms as well. For example, the skin can on the skin the patient can have urticarial rashes, or patient may be feeling itching. In the breathing or respiratory system, the patient may be feeling coughing or wheezing or shortness of breath, or maybe tightness in his throat, or there is hoarseness of the voice, or patient may be feeling nasal congestion, or he may be feeling trouble in swallowing. Then the gastrointestinal symptoms can be like pain and cramps, vomiting or diarrhea or nausea. In the cardiovascular system, the patient may be having some symptoms like lightheadedness or decrease in blood pressure, or the patient's skin color may get turned from pale to blue, that is a sign of cyanosis, or patient may be feeling very anxious, or he may say that I am having headache. So there are many signs and symptoms, but the major one are laryngeal edema, hypotension and bronchospasm. Friends, in anaphylaxis, the treatment or the immediate management and immediate and appropriate management are different. First is administer epinephrine, then we need to call 911 because this situation can even lead to death of the patient. So calling emergency medical services is very important. In case of anaphylaxis, because of bronchospasm, patient may be having difficulty in breathing. So to control that, we need to administer oxygen. In case the patient becomes unconscious, then we will add head tilt, chin lift. In case patient is conscious, then we will only administer epinephrine, administer oxygen and call 911. In case patient is unconscious, we will add another option, head tilt, chin lift. Friends, in the appropriate management, In addition to the above mentioned, that is, all the options that were included in immediate, other than the options that were in immediate, we will or we may add administer diphenhydramine, or administer steroids, so in the immediate management, the first one was administer epinephrine, which is most important. Second is administer oxygen. Third is call 911. In case the patient was unconscious, then head tilt, chin lift. Now, if in the question the examiner asks what is the appropriate management, so then we will choose immediate management options, that is call 911, administer epinephrine, administer oxygen. In addition to those, we will add administer diphenhydramine and administer steroids. And in case the patient was unconscious, we will add head tilt, chin lift. Guys, anaphylaxis is a very severe type of allergic reaction. In case patient does not have cardiovascular and respiratory symptoms, then the mild allergic reaction, its treatment is very simple. You will just administer diphenhydramine. For example, if in this case, guys, let's say the patient was having allergy to latex. Additional information: after placing rubber dam, dentist noticed that patient is having urticarial rashes. In this case, although urticarial rashes are also a sign and symptom of allergy, but patient does not have any kind of respiratory or cardiovascular symptoms. Only skin lesions, that is urticarial rashes or hives, are there. In this case, we will consider it to be mild allergic reaction because of the absence of bronchospasm or laryngeal edema or hypotension. This is a case of mild allergic reaction. Mild allergic reaction. Also remember, the mild allergic reaction, it may take some time, for example half an hour or 1 hour, but in case of anaphylaxis, it can start very rapidly. If you remember, in case of additional information for anaphylaxis, it was during placing rubber dam, that is, it starts in minutes, while mild allergic reaction can take some time because this is a type of type 4 allergic reaction. Now the treatment, both immediate and appropriate management, immediate and appropriate are same, that is administer diphenhydramine. Because this is antihistaminic, so to get over from the allergic reaction, we will just administer diphenhydramine. So the treatment of the mild allergic reaction is diphenhydramine. The other signs and symptoms for mild allergic reaction, or we may call delayed skin reaction, are itching, nasal congestion or rhinitis, maybe watery or itchy eyes, nausea, angioedema and erythema. So guys, don't forget the treatment of mild allergic reaction. Immediate and appropriate are same, that is administer diphenhydramine. Also, while answering the question, please read it very carefully because there may be a very little change in the history. This can lead to a complete change of the answer. You must have noticed that just by writing here after instead of during and changing the signs and symptoms to urticarial rashes, the answer has been changed to mild allergic reaction. Although urticarial rashes are also present in case of anaphylaxis, let's say in case of after, it was just written During placing rubber dam, dentist noticed that patient has urticarial rashes and difficulty breathing. So now, dentist did not mention that patient was having any kind of hypotension, or dentist did not mention that patient was having laryngeal edema or not. So difficulty breathing just because of bronchospasm, one major sign and symptom is there, and skin reaction is there. So just by reading the additional information very carefully, you can answer the question very well in cases of emergency questions. So guys, always remember all the signs and symptoms of all the emergencies, because if you don't remember them, it will be very difficult for you to answer, because the signs and symptoms are very much overlapping, and everyone in my opinion feels this topic to be difficult. So if you know the signs and symptoms, you will be having an edge over these questions. Although in the exam, in ACJ exam, these days the x-rays are deciding factor, but in my opinion, if you look in the cases, the emergency questions are the questions that people feel very difficult to answer. So if you know the answers to emergency questions, you will definitely have an edge on others.